Now, we all know smoking cigarettes is not good for your health, but what about vaping? It's becoming more and more popular. We are happy to welcome back Dr. Andrew Steen to the fore today. He's a pulmonologist with Allina Health. Good to see you. I know we talk about sleep sometimes. Today, we're going to talk about smoking, and I know there's a new study on this. So what caught your attention from this new study?
Vaping has been around for not nearly as long as cigarettes has been around. And it takes us a while to know if something causes cancer. And the case kind of builds over time. And so this new study shows that the evidence is really building quite strongly that vaping is a contributor to lung cancer and oral cancers.
And then how does it compare to cigarettes?
And so that's a question we still don't know, because it's going to take 30 years to kind of see that. It's, you know, when a teenager starts smoking, they get cancer in their 50s, 60s, and 70s. So people who just started vaping a decade ago, we're not going to see how much cancer there is for another 30, 40 years to answer that. So for smokers, smoking raises your risk of lung cancer like 15 to 30 times over non-smokers. So it's a significant rise in risk. This study for vaping just says there's a higher risk, but it doesn't quantitate it.
Well, that's very tricky then, if you have to wait a long time to see the damage, right?
And that's what this study is trying to do. It's trying to put the alarm out now. Like, this is not a safe behavior. Like, we know there's carcinogens in there. We know it's going to cause cancer. We don't know how much that effect is going to be, but now is the right time to stop.
And I know you have conversations with your patients about this too. What are you seeing, the cigarette, the addiction versus the vaping?
There's a lot of people that will switch to vaping thinking it's a safer alternative to cigarettes. And there's probably a little bit of evidence that that's true, that vaping is safer, but that doesn't mean it's safe. I think the bigger concern we have about vaping is it really is targeting kids. I mean, cotton candy flavored vaping is not for the 50-year-old. I mean, it's to attract the 16-year-old. And so that's the problem with vaping, is it's a gateway to more.
And I know there's a whole conversation here, people going e-cigarettes, vape, like the whole shebang there. What are you telling people?
That it's best not to do any of the above.
Yeah, just absolute for you right there. As far as lung cancer in the United States, you were giving me just a statistic that is pretty much just about as bad as it gets of how serious this cancer is.
Yeah, lung cancer is the second most common cancer in the United States. It's the most common cause of cancer deaths in the United States. And any year, it's a little under 250,000 Americans that develop lung cancer.
And I think a lot of people know that, and we kind of associate smoking with lung cancer. But are you really increasing your chances of getting cancer from smoking?
Absolutely, absolutely. I mean, like I said, 15 to 30-fold increased risk among smokers versus non-smokers.
Up to 30 times?
Up to 30 times higher risk.
That really is.
That really is.
Now, are you seeing, I know you said there's a long-term effect with vaping, but are there any effects people are having kind of in real time?
The easy ones we can see, for instance, are school absences and workplace absences. So the incidence of missing school because of respiratory illnesses is higher among vapors than non-vapors. You also see respiratory symptoms like people with more cough and more shortness of breath amongst vapors versus non-vapors.
Okay, and we always want to put a public service announcement out there for anybody who maybe has questions about their lung health. What would you suggest?
I would tell them to get a hold of their primary care provider and ask the questions, and Allina Health and the pulmonary department of Allina Health would love to help them as well.
Okay, Dr. Andrew Steen, thank you so much for that important information.
My pleasure. Thank you for having me.
And you said you're going to talk to us soon, perhaps, about some CPAP news?
I am absolutely thrilled to share that news when it comes. Yeah.
Okay, great. Thank you so much.